All right, I am James Coppinger. I am a nurse practitioner student at YSU, and I will be doing my final head-to-toe assessment on my patient here. So, any questions before we get started?
No, sir.
Awesome. What is your full name?
It is Brett Lee.
Awesome. What's your birthday?
August 6th, 1991.
And then where are we? Sorry.
Hartville, Ohio.
What is today's date?
December 4th, 2023.
All right. Right off the bat here, we're just kind of looking at your skin and just kind of general appearance. Skin appears appropriate color, no real pale spots or real blotchy spots, no lesions noted. You don't have any bruises or scars anywhere. And you're warm, dry. Put your hands out like this for me. Perfect. Skin feels good in your hands. No like clamminess or anything. No hard calluses. I'm going to kind of pinch you here. Skin turgor is appropriate. Nails look good. There's no clubbing in the nails. Go like this for me. Put them together. Thank you. So I can see. No clubbing in the nails. And no abnormalities to the nail bed. You can put your hands down. I'm going to go back behind you here and kind of feel in your head. Look at your hair. Your hair is brown and thick. It looks evenly distributed. No bald spots. Any tenderness through here? Nope. Awesome. While I'm back here, I'm going to go ahead and feel on your thyroid. Go ahead and swallow. No swelling. Everything moves like it should. And your trachea felt midline. It looks midline from the front as well. Go ahead and look right for me. And then left. We're just looking at your neck movement here and your jugular veins. Everything looks good. And we'll go ahead and look at that again when you lay down later. Now we're going to kind of work through the rest of your head, eyes, ears, nose, throat, all that stuff, okay? We're going to feel here above your eyes. Any tenderness through here? Nope. All right, and then down below?
Nope.
Over here, we're going to feel through for your lymph nodes. It's your preauricular, postauricular, submandibular. Go ahead and squeeze tight in your jaw for me. Let go. Work down your submental. Any tenderness throughout?
Nope.
All right, we're going to work back here to your occipital. And then your cervical lymph nodes. Everything's feeling fine, no swelling or anything. All right, next we're going to take a look at your eyes. So going ahead and look straight ahead from you. We're going to start by you following the tip of this pen just with your eyes, okay? This assassin's going to come right at you, okay? Awesome. And your pupils dilate like they should. Next, I'm going to shine this bright light in your eye. You just keep looking straight at the wall for me, okay? Awesome. We're just making sure everything constricts and dilates like it's supposed to. Next, I'm going to have you read this Snellen chart. I just want you to read the line one below the green right there.
It is EDFCZP.
And then cover your right eye. Do it again.
EDFCZP.
And then do the other eye.
EDFCZP.
Perfect. All right, next we're going to take a look in the back of your eye. There is going to be a bright light. I just want you to stay looking straight forward. And then at one point I'll ask you to look straight at that light, okay? Getting real close to you here. All right. We're seeing those veins and arteries back there. The veins are bigger than the arteries. Everything looks good there. Good job. Well, I'm looking here at your eyes. I'm going to kind of pull down your eyelids. Just stay looking straight ahead. No redness down there. Everything looks good. No buildup. Anything abnormal. Next, we're going to take a look at your ears. I'm going to kind of feel on them here. They look normal. Any tenderness through there?
Nope.
Pulling on them, everything feel good?
Yep.
Awesome. Switch this out here. I'm going to take a look in the back of your ear. I'm going to kind of pull up and away while I do. Looking at that tympanic membrane. Pearly white. No buildup or discharge in there. Same thing on this side. No tenderness with that?
Nope.
Awesome. Pearly white tympanic membrane back there. All right, next we're going to take a look at your nose. It seems straight on your face. Any tenderness in here?
Nope.
All right. Go ahead and look up a little bit for me. I'm going to take a look in the back of your nose. Make sure there's no discharge. Might tickle a little bit. Septum seems midline. We're going to look at this same side, or this other side, sorry. No buildup, abnormalities, or septum deviation noted. Next, we're going to take a look in your mouth. So going ahead, and I'm going to take this cover off here. Go ahead and open up real wide. Stick your tongue out. Just shining this light back there. Cheeks look good, no sores. All your teeth are there. Say ah for me. Uvula moves like it should. Everything looks good. And your tongue looks good. Alright, let's set this over here. Alright, next we are going to take a look at your heart and lungs. First, I'm going to palpate over the pulmonic valve, the aortic, tricuspid, Erb's point, and then your mitral valve, and then I'll listen to all those points. And then we'll do some other things with your lungs, okay? We're going to go feel for your mitral valve here. I'll feel there for a second, just make sure there's no abnormalities in your heart rhythm. Alright, everything feels fine. I'm going to go through and feel those, or listen to those exact same spots first with the diaphragm of my stethoscope and then the bell. Listen for a normal S1, S2, hoping for no S3, S4s, or irregularities, okay? And again, I'm going to listen here for a hot second, just make sure there's no irregularities. Alright, I'm going to go back through and listen to all those points again with with the bell of the stethoscope, just making sure there's no S3, S4, or any murmurs. Alright, last here, your mitral. This is your apical pulse as well. And it sounds great. No murmurs, no S3, S4 heard. While I have this out, I'm going to go ahead and listen over your eyes, your temporal arteries, and then your thyroid for any bruise, okay? I forgot to do this earlier. Close your eyes for me. Alright, good job. Next, we're going to go ahead and take a listen to your lungs. We're going to start front. All we have to do up there is listen to your lung fields. And the back side, we're going to do a little bit more. We're going to listen as well, but we're going to do a little bit more back there, okay? Alright, so big deep breath every time I touch you with the stethoscope, alright? Good job. Go ahead and turn sideways for me here. We're just listening to the back side of your lungs. Big deep breath every time, okay? All right, for this part, I just want you to say the letter E every time I touch with the stethoscope, okay?
E, 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 E.
That we're just listening for any consolidation. If there was some consolidation, we would have heard A's, but I heard you say E every time. Next, I'm going to put my hands on you just like this, using the ulnar part of my hand. I just want you to say 99 every time I touch it, okay?
Okay. 99, 99, 99, 99, 99, 99, 99.
All right, good job. And then while I'm here, I'm going to put my hands on either side of your back. I just want you to take a big, deep breath, okay? Big, deep breath. Good job. Perfect. I'm going to go ahead and tap on your back here, just listening for your heart sounds. Okay, same thing on this side. All right, good job. You can go ahead and turn back forward. Remember, I forgot a couple things with your ears that we're going to do real quick. So the first one, I'm going to hit this tuning fork. I'm going to put it right here in the middle of your head. I just want you to tell me if you hear it in both ears, okay?
Okay.
Yep. Awesome. Next, I'm going to put it right here. I want you to tell me when you stop hearing it, and then I'm going to hold it outside and see if you still hear it, okay?
Okay.
And then do the same thing the other side.
Good, stop.
You still hear it?
Yep.
Awesome. Let's do the same thing on the other side.
Stop. Yep.
Awesome. Good job. Go ahead and cover that right ear for me. I'm going to whisper a word. We've done this before. I'm going to whisper a word. I just want you to repeat what I said, okay?
Baseball.
Cover your other ear.
Player.
Good job. All right. Next, I am going to have you lay down here on the bed. Good job. Right off the bat, I'm going to take a look at your neck for any of that jugular vein distension. I'm going to have you lean forward a little bit, look at your neck again, and we're going to make sure that you don't have any hernias, okay?
Okay.
Neck looks good. Go ahead and look right for me. And then left. Good job. And then go ahead and just lean forward a little bit for me. Here's my hand. Look right. Look left. And while flexing that belly, there's no hernias noted. I'm going to go ahead and feel that mitral valve that I felt earlier. And then we're going to have you roll. I'm going to feel it, listen to it, and then I'm going to have you roll on your left side where you do the exact same thing, okay?
Okay.
So we'll put this on here. I'm going to feel you first. Take a listen. All right, go ahead and roll it to your left side for me. This is just putting that heart close to that wall, the chest wall. We're going to go ahead and feel it. Listen. All right, good job. Go ahead and lay back on your back. Next, we're going to take a look at your abdomen. First, I'm going to kind of feel around everywhere lightly, and then we're going to go back. Actually, let's take a listen first. So I'm going to take a listen to all 4 quadrants, make sure you have vowel sounds. All right, and while I'm here, I'm going to listen to the abdominal aortas, like your abdominal arteries, like your abdominal aorta, your iliac, renal, and femoral arteries with the bell of my stethoscope here. Just listening for any bruise. All right, now we're going to go ahead and take a feel. Like I said, the first time I'm going to work around, and then it'll be kind of light, and then I'll go back through and feel around pretty deep, okay? You tell me if you feel any tenderness at all throughout there, okay? Here's your ribs. Feeling this left upper quadrant here, and left lower. Feeling over your umbilicus here. Any tenderness there?
Nope.
All right, I'm going to go back through and feel deeply again. Here's your ribs. We're just feeling for your liver underneath your ribs. Again, over your umbilicus here. Any tenderness or anything throughout?
Nope.
Okay, I'm going to go around here and percuss over your organs. Just make sure everything's good. We're going to percuss over your liver and your spleen and your gastric air bubble. Just make sure everything sounds good, okay? Awesome. Good job. Next, we are going to throw some stuff on the ground. Show me the pocket. What a catch. I'm going to check your abdominal reflex here. So I'm going to kind of run the sharp side of this reflex hammer over your belly. Just make sure your abdominal muscles contract. Everything looks good there. Let me make sure I didn't miss anything here. I think we got everything good there. So go on ahead and stand up for me. I'll sit on the edge of the bed rather. Sorry, scoot down a little bit so we can get you on the camera here. I am going to go through and feel now like your peripheral vascular system. So we're going to feel through your pulses everywhere. Make sure they're even and that you have pulses everywhere. Okay, so we're going to start here on your radial pulses. I'm going to feel your carotid while I'm working up. I'm just going to do one side at a time on this side. Next, I'm going to work down your legs. Back your legs here. Post tibs. We'll do your pedal pulses one at a time. All right, while I'm down here, I'm going to go ahead and take a look at your joints. We're going to start moving your legs around first, and then we'll work back up basically the exact opposite way of the way we came, okay? So moving your ankle here. Everything moves freely. clonic movement in that ankle. Any tenderness? Nope. Okay. Alright, I'm going to go ahead and feel on your knee here. Everything feels like it moves like it should there. No tenderness throughout. Awesome. Go ahead and push up against me with your feet. And then pull away. Then can you push against me with your legs? Pull away. Awesome. Then we'll do your hips a little bit later. Push up against me with your hips. Perfect. It's a little bit harder. Go ahead and put your hand out for me. We'll do one at a time. No tenderness there. Everything moves like it should. Everything feeling good through there?
Yep.
Awesome. Go ahead and we'll do this side first, actually. All right, go ahead and push up against me. Pull down. Push out here. Push out, and then pull in. Good job. Let's see here. Let's go through some reflexes then, okay? We're going to work up each side, and then we'll go back down the legs. So just relax for me as best you can. Perfect. And this one's kind of awkward. Perfect. And this one again, kind of awkward. We're going to work down here to your leg. Down to your ankle. Awesome. Same thing on this side. Awesome. Everything looks good there. While I'm down here, we're going to check for Babinski's reflex. Your toes pull in, they don't flare out, which is good. We did get most of your cranial nerves while we were doing that, but we did miss a couple. Go ahead and smile real big for me. Raise your eyebrows, clench your eyes real tight, and then frown real big. Push up against me here. Turn your head to the right against me. Sorry, other way. Now to the right. Good job. And then I'm going to have you smell something and close your eyes. I just want you to tell me what it smells like, okay? Go ahead and close your eyes and tell me what that smells like.
Marker.
Same thing the other side.
Marker.
Good job. All right, Brett, next I'm going to have you stand up for me. Go like this with your hip. And do your other one. Good job. Then I want you to walk straight at that wall, just normal for me. Turn around and walk back. We're going to do the same thing. This time I want you to go heel toe. That's good enough. You can turn around and walk back. We're doing reverse. This time, walk on your toes for me. Any pain doing that?
Nope.
Okay. And then last one, do it on your heels. This one's a little awkward. Good job, Brett. And then face that wall for me. Go ahead and bend over and touch your toes. We're going to look here at your spine, make sure everything looks good. Straight, no abnormal muscle on one side or the other, and your hips seem even. So you can go ahead and sit back down. Good job. All right. Now I'm going to have you do a couple of things. I want you to, while you're sitting there, I want you to tap like this, back and forth. Awesome. Next, I'm going to poke you kind of throughout, and I want you to tell me where I'm poking you. So give me the side and then the body part that I'm touching. Go ahead and close your eyes for me.
Left forearm. Right bicep. Left calf. Right calf.
Awesome. Can you, with your eyes closed, can you tell me what this is in your hand?
Pen.
Perfect. Good job. You can open them. I'm going to show you real quick while you're looking. This is going to be sharp, and this is going to be dull, okay? I'm going to poke you different times or different places throughout your body. I just want you to tell me if you're feeling sharp or dull pain, okay?
Sharp. Dull.
Look in your face here.
Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp.
All right, Brett. And you were calm and cooperative with me throughout. We started off with your skin. I think your hygiene is great. Cranial nerves are all intact. We went through your head, eyes, ears, nose, throat. Everything looked good. Your scalp was good. Musculature, you did great. Reflexes were all intact. Abdominal assessment did good. I think we got everything. All right. Any questions from you?
No, sir.
Awesome. Thank you, Brett.